Hi, hello. Good morning, everyone. I'm Dr. Andrea Providenti. I'm the product manager of GIMAS. And so I would like to thank you all for being here, for joining us, and for dedicating your time to us. I would like to introduce you our international sales manager, Mr. Roberto Zanarini, who will give you a brief presentation about GIMAS before handing over to Dr. Atef.
Good morning to everybody, and many thanks to participate to this webinar. It's a big pleasure for us that you give us part of your time to share with us. GIMAS is a manufactured Italian company that's already more than 8 years of history. Our products now are already distributed in more than 40 countries. Our company is concentrated right now in two markets, dental and anti-aging. In the dental line, we have one of our biomaterials calling Fisiograft. This product is made up by polylactic and polyglycolic acid. We have a pleasure to have with us Dr. Atef that will introduce in a very proper way all the features and advantage to using these biomaterials, especially in the treatment of bony defect. So now I don't want to take too much time to Dr. Atef because I know that he's very professional and scientific doctor. So he has a lot of things to explain to you, and we hope that this was one of the first webinar that we will do in 2025 because we give us the think that to learn and to teach to the people every day more features and more capacity of our product give us much more importance to do that. So now I give all the opportunity to Dr. Atef to introduce himself, all his background, and to start to his presentation. Any case you have any kind of request or more information, please awaiting the end of the presentation of Dr. Atef, and he will give us all the reply at that time. Thank you so much again for your participation. I hope to see you again in the next webinar that for sure we organize in very short time. Thank you for everything, and I give the place to Dr. Atef to start. Thank you again.
Yes. Good morning, everyone. Have a wonderful day for everyone attending with us. Today, we are going to talk about a very important topic for us as a clinician and wanted to perform a very good outcome for our patients. The treatment of bony defects, facts, and tricks. Okay, let's start by this. This is what we receive from our patients, bony defect. In this presentation, actually, we must ask ourselves what we are going to do for this defect and how we can treat it or not treat it, or we can use the available bone or not use the available bone. So we must go deep in fine details how we can achieve for our patients a very good outcome. This type of defects we face it a lot, okay, and we must know very well how to manage how we can provide for our patient a good outcome for this case like that. And also we receive a case like that. After extraction for hopeless teeth, we have such type of resorption, which is physiologically normal. And this, for example, we have a very large cyst here, okay, so we can see, we can see preapical cyst over the first molar in the upper jaw, and how we can deal with such a condition to restore this and to provide for our patient a predictable outcome. So our presentation today, I think we must answer some question. How the bony defects are formed, from where we can gain these defects. and the type of bony defects must be recognized, which type we face, so we can decide together the challenge what we have and the way or a method we can treat it. How to treat the bony defects and why we must treat it. And technique of treatment of bony defects, how to avoid complications. Before we can go discussing these, I would like to give a little brief about myself. I'm Vice President of the World Dental Council in London, certified implantologist from European Association of Facial Integration, Belgium, associate fellow from AAID from USA, and certified researcher from Lucerne, Switzerland. And I'm a member staff for previously for Imenia University in Egypt. But actually, I always, in my own presentation, I would like to represent myself as Egyptian dentist. I like to represent myself by this way. Egypt is a very big company, a very big country, have a lot of issues to visit, to enjoy it. We always invite you to come to Egypt to see a lot of issues. You enjoy it. This is actually a short brief about my from a long time. I do a lot of courses worldwide. It's in Taiwan, in Azerbaijan, Saudi Arabia, in Egypt, and in France, many countries, focusing in the implant and embryo and the different types, techniques of augmentations. So how the bony defects are formed? We must know something very important for us. When we receive a patient to our clinic and they have a bony defect, we must ask ourselves why we receive a patient with such defects. What is the responsible factor for residual resorption? Okay, because we can have such defects in different dimensions which alter and affect our thinking and our way of treatment. So we have many factors must be considered. For example, the mechanical factor. If we receive a patient, for example, wearing a denture, we must know very well, okay, how many years he wears the denture. And is this denture is fit or not fit, okay? If the patient wearing the denture during sleeping or not, if the patient have a some bruxism or not, if he has a close bite or not. All these factors must be considered because this will reshape the region of the patients, which will affect our policy or our strategy such type of patients. Because if, for example, if we have a fully resorbed spongy bone, we will deal with another strategy or another scenario for the treatment of the patient. So we must go deep concerning the root cause of the case we receive from our patients. Also the anatomical factor, which is very crucial for us, the bone quality and before extraction. If the patient suffering from any problem or something like that, bone quality before extraction, which is leading factor for more resorption or provide for us a lot of bony defect. And also at the same time, we must consider that if the patient is a female or male, because this is actually crucial for us, because always the female have a lot of problem like osteoporosis, because you do a lot of factor can affect it to the pregnancy and lactation and so, and even the some nutritional problem which may affecting the outcome of our work. The biological factor, if the patient have any systemic disease which can affect the bone quality or quantity of the patient, the type of diet, if the patient have anemia, for example, or have any problem biological problem can affect the bone quality of the patient. Because once we had affected the bone quality, we make sure that we have that will affect the bone quantity. So we are receiving our patient with a lot of bone defects. We must recognize from where we get this, okay? So if we go deep and we see the ridge the stage or the groups of the ridge resorption, we can identify this. Very important for us. We have group 1, which is considered minor ridge remodeling, which is very favorable for us. That means that we still have a spongy bone, okay? And the second group, which is a sharp atrophic residual ridge, which another scenario for restoration for the patient or dealing with another scenario. The group 3, which is basal bone ridge, which is very important to know that we dealing with a basal bone. We're receiving actually a lot of cases with fracture of the mandible because we don't recognize these conditions. Why? Because we must know where and which type of bone we deal. We have a basal bone only, or we have a resorbable basal bone, which is every type of stage have a different scenario for treatment. Okay. If we go to the maxilla, we have the same group. Okay, so we can monitoring the way of resolve because the scenario is completely different. When we have the group A, group B, group C, group D, group E, okay, all this is different in different scenarios of restorations, okay? When we correct this bone defect or when we not corrected is very, very, very crucial because we know now all the people who wanted to do everything fast, but everything fast without deep understanding for what we are going to face is very problematic for us. So when we have extraction or something like that, we have different changes happen for us. In soft tissue changes and hard tissues. We discuss about the hard tissues changes. But what is happening for the soft tissue is if you see like that, hard tissue, we have both horizontal and vertical, okay? And 50% within the 20 months of the whole volume is care and 2/4 of the first 6 months. From 2.6 to 4.6 millimeter, we have a horizontal or a width loss, we lose this volume. And the vertical also, we have 0.7%, almost 1.8 millimeter, okay? So we have changes during the extraction, okay? Whatever the cause of the extraction, we already have changes in the hard tissue and soft tissue, and this will provide for us a bony defect. And concerning the soft tissue, okay, we must know the soft tissue is the crucial factor for success of our work because once we have extraction, we have hard tissue. The hard tissue is affected. We have resorption, and by the way, we will have soft tissue changes. Okay. So the height of the mucosa almost 0.5 millimeter in the buccal aspect will it have changing of the relationship between the attached gingiva and the free gingiva. Why you must know this? Because this is actually a crucial factor to understand when we wanted to restoring how much of cartilaginous mucosa we have and how much we must have for attached gingiva to protect our implant for long-term restoration. Okay, so we must know when we extract which type we have for extraction sockets. We have a type 1, which is can be described as 5 holes. We have the 5 holes. We have the 5 holes. This is very favorable for us. We don't have any borers like this case. Okay, so why we must have or must understand the type of extraction socket? Because this is actually will affect the scenario of our procedure or our methodology for treating our patient. If we have the 5-wall index, this means that we have a very nice indication for immediate placement. Okay, we don't need to do a lot of job. But the second type 2, 4-wall, this means that we have 1 wall missing for us. Okay, in case like that, we have this case. It's a very interesting case because the roots already embedded in the sinus and we have oral-anterior communication. This is case is completely different to deal because we have 1 wall which is considered essential wall for us to perform our implants. Okay, so we must know which type of extraction socket we have, so we can predict which type of treatment line we can apply. The third type 3 is 3. Okay, 3-wall defects, that means that we lose 2. Okay, and this case is always we can find, like this case, we see that the roots also is related to the sinus and the open. At the same time, we don't have a buccal wall. Okay. So we must go deeper concerning the theory and the concept to understand how we can augment. The concept of augmentation, why we need augmentation, what is a graft and what is type, what is the principles of bone grafting material. Why actually we need to augment? Actually, augmentation is, or to treat the bony defect, have many important functions. Okay, the people almost working in the available bone have a lot of limitation and a lot of questionable outcome. Because when we augment any defects, that means that we improve the function. Because if we have enough bone, vertical and horizontal, that means that we have a very good, proper selection of the type of the implants, the widths, the lengths, and so on. So we are going to rebuild the apparatus or restoring apparatus, not just fill space. The aesthetic is very crucial for us because most of the patients asking for smile and good predictable aesthetic. So when we correct any bony defects, we improve our aesthetic, our gum. We don't like actually to restoring the defect of the soft tissue by the prosthetic, okay? Because this is unnatural. It is not considered a sort of beauty or restoring the physiology. And when actually we treat the bony defects, we create a hygienic situation for the patient because this is actually represent what already they have before of extraction. That's why we must augment the bony defects. And again, once we do all this, we perform a better occlusion for the patient. Because once we are creating augmentation for the bony defects, this means we can using the correct size of the implant, correct position. That means that we have a better occlusion for our patients. Okay. And once we have all these, this means that the patient can maintain his the restoration in a better way, like the previous natural teeth. And all these factors actually provide for our patient a psychological acceptance. And here we feel more calm. We receive a lot of patients have a problem. We cannot able to show, we cannot be able to clean. It's a disaster after a wrong selection or a wrong protocol for restorations. And all these actually, which give us biomechanical factors, which maintaining the joint for us and all the function of the jaw. That's why actually, when we restoring our bony defects, we do a lot of function and a lot of benefit for our patients. So we must know now what's the graft, okay? Actually, I will speak in general concerning the graft, and then we can go deep how to using the material or we described it before. The graft is a portion of tissue or an organ that after removal from its origin or donor side is positioned or inserted at the different places on the recipient side with the objective for reinforcing the existing tissue and correcting the structural defects. Okay, so we make the graft to correct the structure. Okay, we make the graft to enhance the situation we already have. Okay, so we must know from where we get the graft, the type of graft. It's actually we have different classifications of graft. It depends on from where we get our graft. And generally, okay, we see it's according to the structure. It's maybe we can take it from the cortex, cortex from the skull, chin, body of the mandible, or cancellus, from the tibia, from the iliac crest, or corticocancellus, or a composite block from iliac crest. This is according to the structure, okay? According to the source, we have a different source. And this is very crucial for us to understand that different sources is very important to know it, because we can using some material in a good way, I can mix it with another material to perform a good outcome or something like that. So according to the source, we have autograft or from the autogenous bone, allograft from different human, and xenograft from another living, like from cow or from pig or something like that, from horse, or alloplast or synthetic material. And also, we can classify it according to the embryological origin. Some of them is originated from mesenchymal cell and some originated from echomesenchymal cells. So now we know very well the importance to treat the defect, and we know the type of graft and the source and the classification of the defects we have. So we must ask ourselves the principles of bone grafting. Okay, we have different principles we must know. Like the first one is preservation. This graft, whatever we take it from where, or from human, from animal, from synthetic, whatever, you must know the preservation method to preserve our flap. It's very crucial, because if we take from, for example, autograft or something, is another way. It's if we take it from a ready-made graft from cow or from horse or synthetic, it's different, okay? Trimming, how we can deal with the graft, okay? How we can cut it, we can shape it, we can use it, we can adapt it, all these, because this is actually different from one to one material, okay? So we must know the principles of grafting, okay? And this graft need fixation or not, we cannot fix it. Okay, it depends on the case, but we must put in our mind that some grafts we need fixation, which is very important to know how to fix it and by which material we can fix it, cover it or not cover it, and so on and so on. And the recipient side, which is very important, because we must, for grafting, we must preparing the recipient side to receive our graft material, whatever it is. It is a fresh socket or a healed socket or a fractured bone or whatever, okay? We must preparing the recipient side to be ready to receive our graft. The most important and actually the crucial factor is the soft tissue coverage. All the previous is very good for us to have all and to know, but without soft tissue coverage, that means that we lose all our opportunities. Because the soft tissue coverage, which is the crucial factor, because this is what our graft receiving the nutrient, okay, and what our graft will be protected by the soft tissue coverage. And how we handling the soft tissue coverage and how we can manage the soft coverage to concerning the volume of the flap, because we receive a lot of problem concerning the grafting that there is no accurate proportion between what we insert and the soft tissue coverage. That's why we have we receive a lot of flaps, failed flaps. Why? Because soft tissue coverage is the key success of grafting. And re-entry, the final one. After we have successful augmentation or successful grafting, how we re-enter our flap, because this is many factors must be considered concerning the timing of re-entry and the way of entering our grafted side. Okay, this is very important to know all these. Okay, this is the principles of grafting. Okay, so what is the criteria of our material we're supposed to use for grafting? There are different criteria must be considered concerning our grafting material. The material itself has the ability to produce bone by cellular proliferations from valuable transplanted osteoblast or by osteoconduction. Okay, the ability of this material to produce bone by osteoinduction of mesenchymal cells. The remodeling of the initially formed bone into mature lamellar bone. So this is very important to have this criteria. The material itself, the maintenance of the mature bone over time without loss through the function. This is very crucial for us because sometimes you put the material and by time it disappears. Okay, the ability to stabilize the implant or after our augmentation procedure, if our implant can be stabilized in the augmented socket, in the augmented site or not, if our augmentation material can hold or stabilize implant or is still moving or still soft or something like immature. Also, the low infection liability. It is very crucial because during the handling procedure of our work, we don't need material which are highly suspicious to or highly affected to gain infection, because once we gain infection during our application of our augmentation material, I think we have a very bad outcome. It's easy for availability and it is low indigenicity, which is very important, especially when we take it from human or from animal. High level of liability and self-diagnostic by X-ray. It's very important how we can define by X-ray, okay? Because sometimes actually when we're introducing the material for the socket or for correction of any defect and to make an X-ray, oh, it's okay, it's very opaque, it's good if we have a bone. Actually, it is not a bone. Because this is the radio opacity of the bone particle, because it's already radio opaque. But if you have some material which is self-diagnosis, it means that we changing from radiolucent to radio-opaque, that is have proof that we have actually formed bone. This is very important to know all these criteria. For Professor Dr. Adriano Bertelli have a very nice research concerning that, and we have testing the different type of material in the sinus to recognize which type of material will provide a newly formed bone and the residual material, the percentage. Actually, this is one of the interesting research because we found the synthetic material, the Fisiograft material, is almost producing 43% of newly formed bone and almost 1% of residual material, which is actually very good for us to consider because we don't have more bone particulate. This means that we actually have a natural bone, newly formed bone, which what is the important of that? Important of that we have the BIC, the bone implant contact, will actually larger because we have contact with actually natural bone, newly formed bone, not a bone particle. Okay, this is actually crucial to understand this. Okay, that's why when we choose our material or some indication for our material, it's very important to recognize that we need a more natural bone, a less residual particulate and medullary space. Okay, so after that, all that, we always facing procedure complications. And how we can avoid this complication, okay? Complication risk factor facing the augmentation, we have early complication like pain, bleeding, hematoma, and swelling, okay? And adhesions and necrosis of the donor site itself or a grafted material itself. That's why, as we mentioned before, concerning the material, okay, and the liability of infection, and all these factors must be considered because this is one of the complications. And we have a late complication. This happen actually at the donor site or on the grafted side, okay? Exposure of the screw, exposure of part of the grafting material, exposure of the membrane itself. That's why, as we mentioned before, one of the most crucial factors of the principles, soft tissue coverage. All these factors must be considered very well during augmentation. The complication during implant insertion itself or after bone grafting. After block grafting, maybe we don't have complete healing or mobility of the graft itself, okay? Or impregnated by fibrous tissue, granulation tissue instead of bone, laminar bone, or resorption of graft. And actually, this is, we face it and see it a lot with the bone block graft, okay? After sinus floor elevations, incomplete bone regeneration, or perforation of the sinus. This is one of the complications we face. Complication during and after second stage surgery, exposure of the graft, mobility of the implant itself, bleeding and flap necrosis. All this is actually a complication. Maybe we can face it, but actually we face this because we don't considering from the first, okay, concerning the principles of augmentation and the choice of the material which have fill the requirements to have a good augmentation procedure. Also, we have a late complication after prosthetic restoration. Maybe we have bone loss, rapid bone loss, loss of fixed gingiva, loss of the papilla, all these after complication of the prosthetic restoration. Now we are going to describe some cases concerning work, how to augment, how to treat the bony defect. We are going to represent some of cases to explaining some tricks and how to use the material itself. Okay, so we starting by dehiscence and fenestration case. Look, these patients are coming after extraction like this, and you see the situation like here, like this. Okay, so when we just make a probing like this, we see how we don't have actually, if you review the type of the extraction socket, we suppose we have here some fenestration and dehiscence. Okay, so when we open, we see like that. This is actually one of the interesting way to restore, because we have both dehiscence and fenestration. In this case, we have some tricks. You must know it very well. We must open, don't work blind, actually. You must open a flap, minimum flap as you can, but if it's sufficient to cover, okay, and to explore the defect and you define. You have two solutions here. You can augment only if you don't have enough bone apically, okay, to insert your implant and to treat the defect around the implant. But in this case, actually, we're using the material Fisiograft Basta, which is a very good material, highly indicated in this situation. Why? Because the pasta material is a combination polyglycol lactic acid and hydroxyapatite, and it can fill all the surrounding wall, and at the same time we can build the missing bone or treating the fenestration. We make our implant with drilling, we put our implant in the correct place, okay, and using the Fisiograft Basta, okay. As I mentioned before, it's a combination of polyglycolic lactic acid with a hydroxyapatite, okay? And then we start to insert the pasta to make sure. Why we make the pasta like this? Because the pasta can have an intimate contact with all the side wall we supposed to have, even the excess coming from the fenestration like that. Okay, so we are sure that all the wall of the side is in contact with augmentation material, which is very crucial. We don't use particulate or something like that, or maybe we have voids or something like that. We have something in contact with all, and at the same time, you see, we can build all the missing wall by the basta. Okay, so in this case for fenestration, I recommend for you to using a basta as a material of choice to treating both dehiscence and fenestration. And then you can see we make almost like a wall by the basta to reshape the ridge as you see. So when we open, you can see to have exposure for our implant, you can see how much nice bone we have. Even the implant itself is covered by the bone. And you see how much vascularity you have with the bone, and we don't have any particulate or remnant of the material. Actually, we must consider very important factor when using this material. The time of after, as we mentioned before, re-entry time. The time is very crucial because we said always at least for 4 months, from 4 to 6 months, it's much better to have such a type, more vascularized bone and a very good result like that. Okay, so in this case of fenestration and dehiscence, we're using pasta. Okay. A case like this, as we mentioned before, you can see another case. We have a large bony defects, a patient coming with a failed endodontic, but actually this case is very crucial for us because if we see the X-ray, you can see These molar have a problem, granulation tissue like small granuloma or small cyst, and it is almost touching, as you see in the X-ray, the inferior alveolar nerve. So we have how we can augment this site actually, how we can deal with this actually. This is very crucial for to understanding how we deal with a condition like that, and you have a different type of material which can serve you and malleable for you to have a better outcome. So it must be very careful during the treating of such a case, because we are near from the nerve, and at the same time we need to have a very good site for recipient site for our implant. See, we extract with special tool, we try to remove the cyst or the granuloma, okay, very, very careful without curate or something like that. We must be very, very careful until we remove it. Okay. Yes. We don't need to make to using more curate or something like, don't to touch the nerve, and then you can see the situation. And we need to correct the situation. Okay, patients are waiting for us to restore this area. So what we are going to do now? Actually, we have a deficiency, a body defect in the number 5, and we have a challenging socket with number 6. Okay, so the first molar. So we are going to use a very unique combination. Okay, so first of all, we're measuring the volume of the defect we have, okay? This is very crucial to know which material you can use and which type of procedure you apply. So we measure the defect, we have a large defect, and we started to using the material of choice in this case, which is called the slurry gel. Slurry gel is very fantastic material. Why we using in the socket? Because actually we near the nerve. So we don't insert a particulate or don't insert something hurt the nerve. Okay, we put first the slurry gel to protect the nerve and act like a cushion. Okay, and then we using a large block like Fisiograft sponge like this. Okay, and we cut it as we mentioned before, the principles of augmentation. Okay, trimming, and we cut it according to the site we need, and we cut it to adapt after we make a new wall for the to treating the defect, and we insert the block. And the Fisiograft sponge is a polyglycolic polylactic acid in the form of a sponge. Okay, and another piece here. Okay, so we correct the defect and we make augmentation of the first molar, and we protect the nerve at the same time. This is very important to know how to use a different type of forms of Fisiograft to meet the situation and to protect the situation. Okay, and we tissue coverage in a good way, and this is our coverage now. So when we started to re-enter, as we mentioned before, the principles, you can see this is the X-ray to insert the implant. You can see we have a very good volume. You can see here, okay, a very good volume during the healing, and we open. We have a very good bone, very vascularized bone, and we start to insert the 2 implants in a very good way. And you see during the restoration how much we have a very good, nice contour of the soft tissue, and at the same time, why we have that? Because we restoring first the hard tissue in a proper way. Okay, this is as we mentioned before, proper augmentation, proper using of augmentation material, and the proper coverage, we can gain such a result. And this is the final restoration. So actually, this is very crucial. how to use a different type form to meet your requirements in a specific case like that, okay? Okay, the case after this case is very interesting case. It is a female patient, is medically free, and she came from us suffering from repeated swelling in the endodontic retreated tooth, and they have operation obesectomy, but she have a problem in the upper second molar. Okay, number 5. You see how much we have. And see the X-ray, okay? All this inserted inside, and with the side, you see the X-ray. And this case, you can see we have a different challenge. We don't actually, we have here a bony defect, and almost we don't have a labial wall or a buccal wall, okay? So once we remove all these teeth, we will face a problem side, okay? So how we can treat this bony defect, and which material of choice we can use, okay? We decide actually, we remove the crown, and we start to blend extraction very, very slowly. Actually, we using Bezo to save. We using Bezo to save the remaining bone and to protect the remaining bone, and make a non-invasive extraction. Okay. See what happened when we after extraction. This is huge defect. We don't have any buccal wall, as we mentioned before the type of the extraction socket. Okay, this socket, we don't have this wall totally. Okay, and we have a challenge one in the apical one due to the apisectomy. Okay, so which material we can use to restore that? Which protocol we are going to make augmentation to restoring the bony defect with different type of material. Okay, so we're using the Fisiograft powder and with some surgiplaster, calcium sulfate, to have a mix, which one was a good material. Okay, actually, to have the mix. Okay, why the mix? Because we have we need more bone. Both material is very good, especially Fisiograft powder. We mix it and we make a wall, and then we augment all the side by both material, and then we make the coverage, and this you can see, and we gain after 4 months this X-ray. You can see how the volume we have concerning the length and the width is very fantastic to insert our implants. Okay, so it's very important to and crucial to know, okay, that at this time we're using this combination, and we maintaining the volume, and we have a very good volume to insert our implant. And after 4 months, we opening, you can see how much vascularized bone, how the bone is very nice bone, mature bone, and we start to insert our implant. You can see, okay, we have enough bone surrounding all our implant, okay, and the mature bone, more vascularized bone, because our material, the Fisiograft, producing almost 100%, 99% of newly formed bone. Okay, we don't have any residual material. You can see how the sound of excellency concerning the insertion. That means the implant is inserted in a sound bone, in a mature bone. Okay, so this is very crucial for us to understand which type of material used in different type. And actually the Fisiograft, which its different forms, provide for us a very good solution to in different situations. You can see the implant inserted and in a correct way, and in a mature bone and integrated. The case 3, you can see this case is coming old man and they have a hopeless case like or hopeless tooth like this, and he's medically free, and we remove the tooth. We have a granuloma bically, okay, and we because we after extraction, okay, we make this X-ray, okay, to see that we have almost here a narrow ridge, and it is almost it's not so good to insert the implant the proper way, and we decide to make this defect, to treat this defect for better. You can see here the defect, how much defect we have, and we open, we insert our implant carefully, okay, and we start using a Fisiograft powder with making a wall and mix it and see how we correct the defect, okay? Instead of the bone coming like this, now we have a very nice plateau, okay? So all these, why we do that? It's a very little, but it is enhancing all the 6 factors we described before, to enhancing the case for the maintenance, for the static, for the biomechanics, for the occlusion, for the hygiene, everything, to put your implant in the proper function. See how much we gain, okay, from this little augmentation by good material, which producing almost 100% newly formed bone, and it's and it is totally safe. This case is a very interesting case. Okay, it's a young female, 27 years, medically free. It's coming with a swelling like this in the upper 6, and you can see here. And we manage this case by medicine and antibiotic until it is converted from acute phase to chronic phase, and we start to make our X-ray. See how much cyst we have here, or a big granuloma here, or cyst, and almost you can see here it's almost, we don't have any bone here. It's just 1 millimeter, okay? And we decide to remove, okay? So we have a large bony defect, and the patient wanted something to restore. Which type of material we can treat such a defect? And if you remember the type of extraction socket and the wall, we have here a missing wall, which is very big, okay? So we decide to remove the tooth, okay? We remove the crown. You can see how much defect we have. And we decide to using BISO for extraction to preserve the buccal bone, which is very crucial for us to preserve the buccal bone. And this is a situation after removal of the tooth, okay? And we are going to remove through the socket the large cyst or granuloma, and you can see how much defect we have, okay? And this is actually for us very crucial. The patient wants to have implant in this side, so we must augment it. So we, after removing, and we make preparation of the recipient side to receive our material. We chose the material of choice in a large cyst like that, in a large place like that. The Fisiograft nano reinforces. And with nice application, you can see it's coming like that with a syringe. See how much material the site received it. Okay. Yeah, so can see all this. The Fisiograft nano reinforced is the material of choice in such a case. Why? We have a large defect, and we need to put this material at least for 6 months to have a valuable and good mature bone which can able to receive our implant in a good position. Okay, this is crucial for us to understand the site we have, the problem we have, and which material we can fit with this site. In this case, we're using the Fisiograft nano reinforced. It's a very good material to use it in a space like that. And then we close, you can see how much nice bone we have. After 6 months, we have a fantastic bone. It's almost natural, okay? And how much the plateau here of the soft tissue is very nice. And this will give us the good opportunity to insert our implant immediate function loading temporization, because we have a very nice width and also at the same time length and the quality of the bone. So if you see here, we have a D3 bone, which is considered very good for us. We make it just flapless, okay, and we insert our implants, okay, and we take as the same, and we have a very nice torque for immediate, and we take the impression at the same time, okay, and insert within 24 hours. We finalize everything, and we insert the abutment, and we insert the final restoration. So the final restoration here is it's not zirconia, it's temporary, okay, and it is free, as you see, it's smaller than the other one, okay, the number 7, okay. This is the principles, and at the same time it's free for occlusion. Okay, so it's very nice to see this case. So we without correct planning and correct material, you can see how much the material is good and how much the implant is integrated, okay, and how much we can perform this, because we have a mature bone, we have both volume and concerning the width and the length and also the quality of the soft tissue. So this enables us to insert the implant and the final restoration like that. And the case number 5 is very nice case, and this have a very nice story. And this is one of the good player for football ball in Egypt a long time, and they were supposed to go to play outside Egypt, and at the day of training they have a problem, and the ball coming to his teeth and broken, and this is a big problem. Okay, you can see. And then this patient is highly indicated. Actually, he's young and healthy, and no periapical infection, nothing, no fracture, nothing. Everything is good. 5-wall socket, and we decide to make immediate function loading for him, and using the merit of our material Fisiograft. How we start to extract, okay, the socket is very nice. We have almost all the walls, okay, you can see, okay, and we make the proper position of our implant. And the crucial here is how to fill the gap. In this situation, actually, we're using the Fisiograft gel, because we have a 5-wall socket, and for healthy and young patient, and we're using the proper implant size and proper position. So we need just to fill the gap and to make sure that all the materials in contact with the remaining socket wall. We're using Fisiograft gel. The material choice in this case, you can see the excess to make sure that all the socket is filled by the material, and then you can see remove and make transfer at the same time. And we finalize this case of more than 25 years, okay? And we insert the implant, second day, you can see We're using an implant from a long time, not present now, okay? And this is an abutment, and this is a final restoration, you can see. Okay, so in this case, actually, we're using the Fisiograft gel because we just need to fill the gap with intimate contact with the safe material, because the Fisiograft itself is it's a hemostatic and also antibacterial. So it's a sort of good material to use it in such situations, and a very successful case actually from long time. Actually, by this case, I would like to finish my presentations. By this statement, you may have the good intention to do good things. You may have the noble target, but actually, without the correct principles, you cannot gain any success. I'm really happy to have you in my presentation. If you have any questions, I will be happy to answer all questions you receive. Thank you very much.
Thank you, Dr. Atef, for your amazing presentation. I think that you offer to our participants a lot of cases to explain the features and the capacity of our Fisiograft. So in case someone have some question, please, this is the moment to tell us, and Dr. Atef is at your disposal to reply. In case, I would like to inform you that we will send to everybody, the participant, this presentation after the webinar. So maybe you can better learn the information that Dr. Rafet shared with us during this very nice presentation. And we are here just to reply to your question. If there is no any question, maybe we can say hello to everybody, and we can see in the next future for the next webinar that we will have pleasure to organize with the with Dr. Atef or with our keyhole for other products that are in our portfolio. I just would like to remind you that the Fisiograft is available in different forms. So we have in powder, we have in sponge, we have in gel, slurry gel, and also in addition with hydroxyapatite, we have a nano-reinforced and pasta. So in any case, you want more information, you can go to visit our website, is www.gimas.com, and in that page you can find all the information about our product. Or you can contact us by email or by WhatsApp in any case. So I think that there is no questions.
No questions. Everything is clear.
You are very, very professional, very scientific presentation, so everybody understand perfectly what did you explain to them. So any case, if someone after the webinar needs more information, can send us an information and we will share with you, Dr. Atef, and maybe you can reply directly or through us to them to clarify any kind of a problem. Give now the space to Dr. Providenti to say also hello, and then we say hello to everybody. I wish you all the best and see you soon.
I also want to say thank you to everyone, and so we hope to keep in touch. Bye-bye. Have a nice day.
Thank you very much.